So let's now define what we mean by an injury. And essentially, an injury happens when the force or load that is applied to a particular tissue of our body, or the speed or velocity at which that force or load is applied, is greater than how the body has been trained to deal with. And the result is that these tissues will become deformed and are no longer able to actually fulfill their function. And during the course, we have touched on persistent pain, and we have recognized that the vast majority of cases of persistent pain are not coming from the tissues of the body themselves, but they're actually coming from the nervous system. And it's not helpful to say, oh, it's all in the head, but we have to recognize that depression, anxiety, fear, stress play a huge role in our experience of pain. And we can define pain in a similar way to injury. And we can say that when all the demands that are put on us, so physical, emotional, psychological, spiritual, when they are greater than the coping mechanisms we have to actually deal with the demands, then we can experience pain as a result. And then when it comes to a condition, that term is a kind of broad umbrella term for different diseases and illnesses that can happen in the body. And there are also things that are not pathological, like pregnancy. So that is typically a condition, and also technically mental health is included in that umbrella term as well. What I would like to do now is look at some of the research that has explored how common injuries are in yoga, and some of these actually also compare yoga to other forms of exercise. So in 2019, Kramer and another group of researchers conducted a cross-sectional survey, and they found that the rate of injuries per 1,000 hours of yoga practice was as little as 0.6. So that's really, really small. And they happily stated that yoga is as safe or safer compared to other types of exercise. And interestingly, they also comment that adverse effects were more common in students who had a pre-existing medical condition, and also among students who either practiced on their own without prior supervision by a teacher, or without current supervision by a teacher. And then also in 2019, there was a similar study that had similar results, and they found that yoga is a low risk form of activity when compared to other physical activities. And then finally, in 2015, by Kramer, who also was involved in the first study that we talked about, this is a systematic review and meta-analysis. So this is the gold standard of evidence base, and we'll look at what these terms mean in Module 6. And this gathers together all the research done on this topic and concludes that yoga is as safe as other forms of physical activity.